This is an injectable version of undecanoate. Internationally, it is sold under the name Nebido, and in the United States is called Avide. This is a long-lasting ester that stays in the system for extended periods. The injection is usually administered every 10 to 14 weeks, and for use in the U.S., the manufacturer claims that only 5 doses are needed all year. The catch: there are many concerns about adverse side effects. Testosterone suspension acts fast, very fast. This is an ester-free, water-based form of testosterone. For this reason, it is not the preferred testosterone for TRT. Rather, it is hugely popular in the performance-enhancing circles of athletes, especially powerlifters, since it delivers a rapid effect and skyrockets explosiveness. One concern is the painful injections. There have been reports of the injected limb becoming numb for a period, with moving the arm becoming challenging. All in all, the risks outweigh the benefits when it comes to testosterone suspension. As I mentioned earlier, these are the 2 most common types of testosterone esters available in the United States. Here are a few differences that will hopefully enable you to make an informed choice. Enanthate is manufactured worldwide and is, therefore, more common throughout the world. Cypionate is usually more common in America. Cypionate is suspended in cottonseed oil. Enanthate is suspended in sesame oil. Enanthate consists of a 7-carbon ester chain. Cypionate has an 8-carbon ester chain. The rule here is that the greater number of carbons the ester contains, the more soluble in oil and less soluble in water it becomes. Therefore, cypionate has a somewhat slower release and stays in the system a bit longer. Enanthate has a slightly larger amount of testosterone per milligram than cypionate since it is 1 atom lighter. However, the practical difference is minimal. Enanthate is slightly cheaper than cypionate. As you have probably figured out, the differences between the 2 are relatively insignificant. When it comes to effectiveness, many users that have tried both can't tell the difference in how they feel and the results delivered. So there you have it. Now you know just how significant esters are. They have one primary job to accomplish: slowing the release of testosterone from the injection site into the bloodstream. The ester lowers the water solubility of the testosterone, which causes it to accumulate in the muscle tissue. Then it is picked up by the circulating blood and slowly enters the system. Remember this simple rule: the longer the ester chain, the lower the water solubility. Thus, it takes longer for the full dose to fully circulate throughout the bloodstream. Testosterone is testosterone regardless of the label. It is the ester that makes the difference, since the key factor is the amount of time it takes for the testosterone to get to work. Our trained, experienced, and professional staff will guide you through this maze, every step of the way. The price, the frequency of injection, close monitoring with extensive blood work, answering any questions you may have, and addressing all of your concerns. We do it all. Contact us for the most cutting-edge, up-to-date testosterone replacement therapy. We guarantee our results delivered in a safe, efficient, and convenient manner. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.